like any community gathering, sharing, and just communing in the same place, it's a big part of what we're all about. And over the past 2 years, we did what we had to do under the most trying of circumstances to keep our remote membership assembly as relevant and productive as possible. So I'm proud of all the work done by the ANA board, representatives, committee members, and our staff to make the virtual meetings the successes that they were. But now we're back together again, and it feels great. I wish we could say that the pandemic is over, but as we all know, the virus continues to mutate, and each variant has called for renewed vigilance by public health. As nurses, we can take pride in the work we've done to care for patients, encourage their healing, ease their suffering, and educate our communities about vaccinations. Our profession has been front and center in making a difference. And yet we know we need to remain vigilant and continue to do what we must do to protect ourselves and each other. You just heard President Grant make an impassioned plea for advocacy. You, the activists of this organization, are the ones to make this happen. And here in Washington, D.C., and in state capitals across the country, we have channeled our very best contributions into this work. That was certainly evident in the success of this year's Hill Day. From our early reports, it appears we had more than 270 nurses and nursing students taking our issues directly to members of Congress and their staffs. And I want to thank all of you who participated yesterday. What you did was vitally important to ANA's advocacy program. It strengthens and deepens our impact throughout the year. And while I understand that some visits may have been virtual due to congressional office protocol, for those that did have in-person meetings, I trust it was great to be back on Capitol Hill. Good. Of course, there's a lot of time and effort and carefully crafted positions that go into advancing our advocacy work, and a contributing component is our dialogue forum process, which is aimed at ensuring that the voices of our members are reflected in the positions ANA takes and the issues we prioritize. This year, through the process, we will discuss and consider recommendations on 3 highly relevant issues put forward by our members and the Professional Policy Committee. You will have the opportunity to engage in discussions, raise questions, and offer recommendations that will inform ANA's work on the impact of climate change on health, workplace violence, and nurse staffing. ANA actually has a historical position statement on climate change and health, and this dialogue forum will give us the opportunity to bring it up to date and to consider recommendations that can be informative for our board as they consider our strategic direction this summer. Unfortunately, workplace violence is continuing to be a challenge. The pandemic has only heightened the need to continue to build tools and advocate for strong solutions. We continue to work with Congress to pass legislation and are working with federal agencies to review and update regulations. And then there's staffing, a major, if not the primary, pain point for nurses. It's time to hear from you about whether we should modify our approaches. What do you hear from the nurses who work in your state, region, or specialty? I hope you've had the opportunity to review the most recent staffing think tank recommendations born out of our partnership work. This week's dialogue, the think tank recommendations, and our ongoing staffing task force will collectively inform our direction on this most important issue. We have important work ahead, so let me shift to the real focus of my report today, and that is to inform you of the progress that has been made on last year's dialogue forum recommendations, what's been done since you approved them last year as our policy decisions. As you may recall, there were 4 dialogue topics last year: and all resulted in approved recommendations. Staff then developed work plans for each topic, which were approved by the ANA Board of Directors in September. So let me run through them quickly. Dialogue Forum 1 last year took up the issue of universal health care coverage and reform, particularly in the context of fully incorporating nursing services into health delivery systems. Participants adopted the position to endorse universal health care coverage that ensures equitable access to comprehensive nursing services, incorporating appropriate reimbursement of all needed services, and full practice authority for all nurses in the healthcare delivery system. This resolution thereby rescinded the 1999 House of Delegates approved policy endorsing single payer as the most desirable option for financing a reformed healthcare system. The work plan focused on ANA's efforts to highlight nurse-led care and delivery in payment models and other innovative approaches. Staff was directed to look for opportunities to raise the issue of equitable payment for nurses and the opportunity to practice at the top of their license and education. This, in addition to seeking opportunities to advocate for patient access to quality care. Although most of Congress and the administration's efforts were still focused on COVID, ANA's policy team developed comments on various Medicare payment rules, and we were successful in achieving full practice authority language in Title X for reproductive health for APRNs. ANA continues to represent nurses on the American Medical Association committees, which focus on the development of procedure codes and the valuation of these codes. We've also been working to include provisions in upcoming legislation to remove barriers to APRNs treating Medicare and Medicaid patients to allow for full practice authority. We've engaged key federal agencies and advisory boards on strategies to center nursing in existing and innovative models. Through our comments to the Department of Health and Human Services strategic plan, through our advocacy for strong non-discrimination regulations, and through the comments we've provided to the PTAC, which is the stakeholder group that recommends pilots to the Centers for Medicare and Medicaid Services. In Dialogue Forum 2, focused on the development of a strategy to integrate precision health and genomics into basic and advanced nursing practice. Launching this work was unfortunately delayed due to the continuing and at times increasing demands of our COVID-19 work. But plans are underway to get this back on track with an initial focus to better understand how precision health and genomics can increase therapeutic efficacy, safety, and quality while reducing healthcare costs. The recommendations outline several elements that could form the basis of our work, including developing a framework for ethics, privacy, security, and cost effectiveness, establishing entry-level and advanced nursing competencies for precision health, and updating the genomic competencies for nurses with graduate degrees. We've pulled together a team of volunteers and staff who are working on 3 core objectives. The first is to complete the revision and updating of both the basic and advanced competencies related to genetics and genomics. Secondly, early next year, we will launch a national survey to better understand the current knowledge of nurses related to both genetics and precision health. And the third objective is to develop competencies for precision health, which we expect to have completed by the end of next year. In Dialogue Forum 3, as you can see, there's a good deal of work going on last year. It focused on how we might achieve APRN full practice authority in nursing homes. That forum produced recommendations advocating for changes that would authorize APRNs to directly bill for services provided for skilled nursing care, long-term care, and home and community-based care, including those services provided as an employee. This being specifically addressed in our efforts to include language in upcoming legislation provisions to remove barriers to APRNs. and we will be specifically referencing nursing homes and other skilled nursing facilities. We're going to continue to push for adoption, and we'll call our members to action when the legislation is proposed. And then Dialogue Forum 4 last year was focused on COVID lessons learned, specifically around crisis standards of care. Participants in this Dialogue Forum directed the staff to report back to this year's membership assembly on actions taken to further address crisis standards of care and advance the nursing profession's response to future disasters and pandemics. As we all know, at the time, our Dialogue Forum last year, there was a feeling and really a hope that maybe the worst of COVID was behind us. And of course, that ended up not being the case. Nevertheless, we did make progress, and ANA is planning a full review of our 2+ years response to COVID to identify what worked and what should be moved forward. This review includes practice and policy decisions, as well as how effective we were in execution and communication with our members, the broader nursing community, policymakers, and the media. Tomorrow, one of the special sessions we've planned is on lessons we're learning from the pandemic, and that dialogue will inform further planning on the work that was started last year. The session will be an opportunity for all of us to explore the innovations we've undertaken at federal and state levels in response to COVID-19 and what has been working and what should be continued. How can we build on our foundation's Pulse of the Nation's nurses surveys to ensure we understand nurses' needs? And how can we leverage our experience creating and evolving the offerings of our COVID Resource Center to better deliver on what nurses need on other emergent topics? What worked well for our constituent and state nurses associations that we would want to help build on? And how do we keep that momentum going? What can we learn from our experiences to continue to show the value of nursing and to advocate for appropriate work environments, compensation, and the well-being of nurses? I hope all of you plan to be highly engaged in the Lessons Learned session tomorrow. This process of exploration and discussion is really vital to what we are building as a better, more responsive organization. Your input and engagement help us become more influential as well. And that's good for nurses and the profession, and for improving patient care and for building a better health system. 1 year ago in our virtual meeting, we did not imagine that COVID-19 and its variants would continue to have such a devastating impact on our nation and really highly influence the work we've done at the enterprise. We intend to leave this membership assembly with renewed optimism and direction, remaining focused on this body's priorities and our board's strategic direction. We remain grateful for your input and your guidance, and I especially want to say thank you for the outreach and the support you provided this year. We could not have done this critical work without the commitment of our members. Thank you again.